What birth intervention myths are false? Imagine planning your perfect birth and hearing all sorts of stories that might not be true. It's easy to get confused with so many opinions floating around. Let's clear up some common myths about birth interventions. First, many believe that labor always starts when your water breaks. Actually, only about 15% of women's labor begins this way. Most often, contractions are the first sign of labor. So waiting for your water to break isn't a reliable way to know labor is starting. Next, some think that getting an epidural automatically means you will need a cesarean section. That's not true. An epidural is a safe pain relief option that doesn't increase the chance of a cesarean. The decision to have a cesarean depends on many factors, not just pain management. Many women worry that if they have a small baby or wide hips, their labor will be easy. But that's not always the case. The length and difficulty of labor depend on the baby's position, strength of contractions, and overall health. Physical traits alone don't guarantee an uncomplicated birth. Some believe midwives won't allow pain medications or epidurals. Actually, certified nurse midwives and other midwives can provide pain relief options, including epidurals, depending on where you give birth. They support your choices and work with you to make your birth comfortable. Another myth is that cesarean sections are an easier way out compared to vaginal birth. That's not correct. Cesareans are major surgeries with longer recovery times. While they can be life-saving, they are not a simple alternative. Many think that without lots of medical intervention, a woman's body won't know what to do during birth. But most women's bodies are naturally built to give birth. Creating a birth plan helps communicate your preferences and supports a positive experience, whether interventions are needed or not. Lastly, some believe that babies need to be slapped on the back immediately after birth to start breathing. That's an old myth. Usually, babies start breathing and crying on their own. Gentle stimulation might be used if needed, but slapping is not standard practice anymore. Knowing these facts helps when you're creating your birth plan and talking to your healthcare team. It allows you to make informed choices and understand what's necessary versus what's based on myths. Remember, birth is a natural process, and medical support is there to help when needed, not to complicate what is often a beautiful experience.